Good afternoon, everyone. My name is Marie, and today we'll be covering hypothyroidism and the common treatment of levothyroxine. So what is hypothyroidism? So hypothyroidism is a condition in which the thyroid gland fails to produce enough thyroid hormone. So what causes it? There are a few causes of hypothyroidism. They can be linked to autoimmune diseases, a thyroidectomy, radiation, and even certain medications that can cause it. So what are some signs and symptoms that a patient with hypothyroidism may exhibit? So generally you can just think of hypothyroid. Hypo means slow or low. Everything just kind of slows down in the body. So the patient may exhibit fatigue, constipation, dry skin, weight gain. They may have throat hoarseness from a goiter that is there, muscle aches, thinning hair, decreased heart rate, and even depression. So how is hypothyroidism diagnosed? So the patient presents to their physician with these signs and symptoms. The physician will conduct a thorough health exam, obtain their history, medications, and then draw some labs. Ideally, the lab that they're looking for is the TSH. So once a patient is diagnosed with hypothyroidism, then the physician and the patient will talk about treatment. So the most common treatment for hypothyroidism is through the use of a synthetic hormone called levothyroxine. Levothyroxine is the generic name. Some other brand names that you may have heard are Levothyroid, Synthroid, and Unithroid. These work by mimicking the role of the thyroid hormone, T4, and due to this replacement of the thyroxine, the thyroid deficiency is resolved. Excuse me. So more about this drug. Anyone can take levothyroxine, but the dosaging will be different. For instance, for the elderly patients, they should start out with low doses and with slow titration, just because the elderly population have a decreased absorption rate. So physicians, want to start these elderly patients off with a low dose and kind of titrate slowly. For pregnant women, dosing will be based off their trimester and their TSH levels. So each trimester, first, second, and third, will be different dosages for each woman. As mentioned, anyone can take levothyroxine. This includes newborns and children. Newborns can receive levothyroxine. It's based off weight, so 10 micrograms per kilogram a day. That is how their dosaging is calculated. For children, it's basically the same way, except it's 4 to 6 micrograms per kilogram a day. Adolescents, it's 2 to 4 micrograms per kilogram a day. And for adults, it's 1 to 6 micrograms per kilogram a day. So based off these basic calculations, then that's more or less the range that the patient's dose will be in. So usually for hypothyroidism, it's a lifelong condition, so they'll have to be taking levothyroxine usually for the rest of their life. Once the treatment has started, physicians will kind of monitor their TSH levels approximately 6 to 10 weeks after the initial treatment, or if the dose is titrated up or decreased, then the physicians will monitor those levels as, like I said, 4 to 6 weeks after that dose. The levels will be monitored periodically until the levels are stabilized. Once the levels are stabilized, then annual serum levels are recommended. So it is still recommended by physicians to monitor those levels just to make sure that the treatment is still therapeutic and that the dosage doesn't need to be titrated. So as nurse professionals, part of our role as a nurse is patient teaching. So we must teach our patients about this medication, levothyroxine, Some important information that we must teach them is to take this medication on an empty stomach with a full glass of water. They want to take this medicine about 30 minutes before breakfast. They want to take it separately from any other meds that they may take in the morning, just because you don't want to counteract the levothyroxine with any other medication that can decrease the absorption of the levothyroxine. You can crush this medication. So say if you have a child that is kind of difficult at taking medication, you can teach the parent that they can crush the tablet and kind of mix it with some applesauce or yogurt or anything of that nature, just as long as the medication is being taken. You want to encourage that they don't miss a dose of this medicine, so encourage them to set an alarm, to write it on a calendar, or to have it at the bedside with the pill container, whichever would work better for them, but just encourage them to try to be as compliant as possible and not miss any doses. If they do miss a dose, you want to make sure that they don't double up on a dose, because this can mess up their levels as well. You want to make sure that they protect the container of the levothyroxine from light and moisture, so just kind of keep it in a cool room temp. And you want to make sure that they attend their follow-up appointments with their doctor, especially when they're in that beginning phase where they're trying to figure out the therapeutic dose for them. You want to make sure that they keep their appointments and are getting their labs drawn regularly. Alright, now that I taught you guys about hypothyroidism and levothyroxine, it's time to test your knowledge. So question number 1. What are some brand names of levothyroxine? Is it A, Unithroid, B, Synthroid, C, Levothyroid, or D, all of the above? Awesome, it is D, all of the above. Number 2, which thyroid level do physicians monitor? Is it A, TSH, B, LDH, C, CMP, or D, TSP? Correct, it is A, TSH. Alright, one more. True or false? Treatment for hypothyroidism is usually lifelong. That is correct, it is true. Alright, you guys, great job, everyone. As nurses, it is essential for us to be familiar with any medication so we can teach our patients about it. Not only does this enhance patient care, but it also optimizes their health. So thank you all for listening. Have a great day.